Welcome everyone to AT Training's next in line in the webinar series. We are really excited to have you all here today and attending this webinar. I can see there are some questions in the chat already. We will discuss those at the discussion section, so don't worry if we don't get back to you immediately. Welcome to the My Ability webinar. As you can see, the title there on screen is around developing self-worth and independence and identity in young people. We have got Emma, Nikki and Andrea today presenting. So we've got a joint collaborative effort between AT Therapy and Ricolo. So if we get started with the first slide. My name is Emily. I'm one of the specialist speech therapists at AT Therapy. As we go along, do feel free to keep adding into that chat box. Please do be aware that the webinar today is being recorded, so it will be uploaded to AT Therapy's website and YouTube channel. So any information that you do need from the webinar today will be freely available to you once everything has finished. We're very excited to have the presenters that we've got today. They're all very talented ladies, and let's get started.
Thank you, Emily, and hello, everyone. Our intentions today are to share with you the importance of identity work for both an individual client, but also for their engagement with rehabilitation. The role of the speech and language therapist within identity intervention, how that expands to a wider MDT role, and the need for collaborative working on identity and self-esteem. A resource we are developing to facilitate this intervention called My Ability, and future applications and next steps with this.
So in rehabilitation, we're very much aware of the multiple agencies actively invested in promoting change and recovery following TBI. The different services involved, there may be private, like AT Therapy and Ricolo, NHS, local authority, charities, different professions, and of course the family members. And the focus in an MDT, particularly in the early days, is on physical domains of care, and survival, breathing, swallowing, movement, physical adaptations, and that's rightly so. But we very much are aware that once the initial storm has passed, our rehab focus needs to expand to include the psychological facets of a young person's understanding and belief about themselves. And we feel this is key to progress long term. The self of the young person in us as a team is the anchor to motivating and promoting a good recovery. And as different services and professions, we each have a role to participate in this process. Research over recent years has seen a growth in understanding identity from many different dimensions. And Chara, our MSc student who's joined us, has been researching the role of the MDT within identity work and found a breadth of perspectives from various professions, such as OT, researching role identity disruption and the impact on participation in the community. And of course, speech and language therapists focusing on identity narratives and disability-focused discourse. It is by working together that we can better capture the fullness of an identity, as well as its diversity and unique complexity.
We may ask why therapeutic support for a young person's identity is important, but evidence shows that how a young person understands and relates to their injury or diagnosis has a direct impact on their engagement in rehabilitation and therapy through active involvement in decision-making, acceptance of their diagnosis, awareness or insight into their strengths and challenges, and adjustment to life-changing circumstances. Active adaptation, so doing things differently and working around those obstacles, factors that ultimately directly impact on rehabilitation and therapeutic outcome.
In the field of autism research, there's very little evidence around the use of direct intervention on identity, delivered by any clinician, really, regardless of their professional role. So as clinicians supporting young people to develop their independence and their assertion skills, it's hugely important for us to ascertain their views, really, and to involve them in an ongoing, appropriate decision-making process. And that can be about a range of things to do with their life. However, often little direct work on identity is actually undertaken in preparation for this. Billington's work on identity and autism highlighted the need for clinicians to engage with narratives of an autistic experience to improve overall outcomes for the individual. So in earlier work by Hinshelwood, the movement between an individual's sensations, environment, and social context were discussed and found to have huge implications on self-identity as a result of this. However, in much of the limited evidence available, little consideration is actually given to the frameworks that underpin identity and the experiences that can affect its development. It seems well agreed by a range of clinicians that we should search creatively for ways in which to gain the views of an individual to support the discussions about identity and the way in which they manage their own world around them.
Research in the field of TBI showed that following injury, there develops a duality, a splitting of the self from who I was to who I am now. And young people are particularly challenged because not only are they adjusting to a different self-image following injury, but they are also on a developing continuum of change as they progress through transitions from childhood to adolescence to adulthood, each developing individuality and autonomy. So TBI adds further challenges and potential for confusion and disorientation. Within the field of TBI, interventions on identity have focused on the process of adjustment, and that needs to build on an awareness and understanding of the current self, as well as the past self, in order to facilitate acceptance and adaptation of a consolidated sense of self. The adaptation takes place through experiencing real-life situations when the individual is interacting with other people and the world around them to facilitate a greater understanding of themselves and their capabilities. We may consider as clinicians that a young person perceives themselves as getting used to a new self and life course, but I've been struck by one of my patients who said, no, it's not new. It's just me. It's my life. It's the twists and turns of my life. And we have a great deal to learn from co-production and our service users being involved in our intervention. The research is less clear when looking at neurodevelopmental disorders, as Nikki mentioned. However, the presenting clinical need is the same, as they pose the questions of, why am I different? Who am I? Will things change? It's about supporting the young person to develop an understanding of their self in relation to their self, in relation to others, and within the context of their world, helping them to understand their self-worth, support them to aspire and achieve their own meaningful goals.
So, speech and language therapists are often overlooked as a clinician who would work on this area. Interestingly, when asked at a recent Clinical Excellence Network, numerous speech and language therapists stated that they would just automatically refer to psychology to provide intervention for identity work. But following a brain injury, physical, cognitive, emotional, behavioural needs interact with each other, and communication is involved with each of these processes. Speech and language therapists can provide crucial intervention that supports the development of communication, social skills, and emotional regulation. Recognition of reoccurring and overlapping areas of intervention within neurorehabilitation is limited, alongside understanding the full remit of a speech and language therapist. For example, it's acknowledged that a speech and language therapist provides social skills interventions. However, the core foundational skill from the hierarchy of social skills provided by Alex Kelly in 2009 is regarding awareness of self and others. Therefore, without awareness of self or difficulties with identity and low self-esteem, a client will present with ongoing social communication difficulties and intervention at higher levels of the social skills hierarchy, such as conversational skills or assertiveness skills, will be redundant.
So as we said, all team members, whatever the profession, are motivated to promote a young person's acceptance and adaptation to their diagnosis. Fran Sefton initially approached me to explore how she could help young people who are curious about the nature of their cerebral palsy diagnosis, and we agreed to work together collaboratively to develop a containing structure for such a sensitive conversation in sessions. We then invited Nikki and Emma to collaborate on developing packs tailored to our clients with autism and traumatic brain injury to respond to dual diagnoses and the acknowledgement that identity is a broad issue impacting on a number of our client groups as they start to question who they are in adolescence and young adulthood. Our initial aims were to develop parallel groups for young people and their parents and carers to share their experiences, build support systems, as well as promote understanding and strategies to adapt. We worked on creating packs of activities that structured a therapeutic conversation to promote self-identity, as well as strategies for the regulation of strong emotions that were triggered by changes in their self-image. This involved pooling our ideas as therapists and developing resources both to be used as pencil and paper exercises, as well as online and adapted to AAC to facilitate an understanding of their diagnosis, the expression and regulation of emotion in relation to their self-identity, and activities that would assist the young person to adapt a more cohesive and positive view of their self-identity. As I mentioned, we've been co-producing resources with AT mentors within AT Therapy. These are skilled users of AAC, and they're working alongside our young people and clinicians to support adjustment and adaptation.
And so we embarked upon the development of MyAbility. There are 3 separate packs currently in development. Each MyAbility pack targets a separate diagnosis. So one's for cerebral palsy, one is for traumatic brain injury, and one is for autism. So the overarching aim of each pack is to support clinicians in having sensitive conversations with clients around identity and self-esteem, supporting them to understand a diagnosis and what that diagnosis means to the client individually, encouraging acceptance of this, and then the promotion of positive self-worth. The resources, tasks, and language used within each of the packs has been amended to appropriately reflect the different needs within each of these diagnoses. This is a snapshot of what we have now called MyAbility. So MyAbility is a program of 14 activities that are a template to be used flexibly and adapted to a particular young person's or clinician's needs. We have developed it for young people aged 10 years or over who have an understanding of at least 3 keyword levels or above. For each session, there are key tips, activities to help an individual to understand their ability, as well as homework tasks to complete in between sessions and promote ongoing generalisation. Therapists within the AT Therapy and Recolo teams have begun to trial MyAbility with young people in the rehabilitation process following a traumatic brain injury. An example use of MyAbility with this client group is with a young person currently on one of our team's caseload who've experienced TBI when she was in primary school as a result of a road traffic accident. This young person finds it challenging to identify her new strengths and accomplishments, and instead focuses on what she has lost and can no longer achieve as a result of her injury. By completing tasks within the MyAbility TBI pack, she has begun to identify and acknowledge the positives that she is able to achieve and to begin to accept and celebrate who she is as this person right now. Also, the person that she would like to be in future. The use of a single tasks from the programme has also been trialled with some clients who may not be ready to access all of the sessions, but would benefit from a facilitated discussion around some topics covered, such as learning more about traumatic brain injury or beginning to connect with other young people with similar experiences. One of the team has recently used perceptions and feelings tasks with a young person who struggled to articulate his views on himself and his worries around the person he might become without support and guidance. With the help of the My Ability task, he was able to participate in a discussion about those concerns and begin to formulate a list of goals to ensure his life post-injury begins to move in the direction that he wants to.
So although there have been many successes when we've been trialling the delivery of the packs, there have also been some challenges. As travelling clinicians who largely work with young people in a face-to-face capacity, it's been really challenging as a result of the COVID-19 pandemic and all of the restrictions imposed as a result of this. It's had a huge impact on how we deliver our interventions and our ability to adapt the resources that we'd initially designed to enable them to become more appropriate for telehealth methods of delivery. So that could be online therapy sessions on, video conferencing platforms such as Zoom or Teams or WhatsApp. It's also enabled us to become more confident in selecting which sessions actually were more accessible in an online format and which sessions were more difficult to access in this way. Our delivery of My Ability during this time has had to be flexible, often involving the delivery of the programme in a different order than was originally designed. So starting with tasks that are more suited to online delivery, such as the My Ability quiz and role models task, and sessions that would be more beneficial in a face-to-face visit have been saved till later. So these until we could again access this form of input. Further work is currently taking place on providing additional resources for tasks to make them more suited to remote learning.
So we've completed a feasibility study, and this is a study to see how useful this approach is. And we carried this out with clinicians at Ricolo and AT Therapy, our young people and their parents. And this was during the COVID-19 pandemic lockdown from September through to January. So unfortunately, the numbers we received in responses were small. So we were not able to extrapolate differences between the packs. However, the study certainly demonstrated its usefulness as a clinical tool for clinicians, young people and their parents. The findings indicate that young people valued learning more about their diagnosis, talking about their feelings and perceptions of themselves currently, and ideally in the future, connecting with others with similar experiences, as well as acting out social situations to practice coping with tricky interactions. And parents valued getting more support for their young person, and clinicians found it useful to connect their young person with others and to explore their clients' feelings and perceptions of the self. When analysing comments about My Ability, it was found that it was helpful to open up sensitive conversations about feelings, to identify strengths, and to be able to focus on the future by aspiring to the client's own meaningful goals.
As a result of our initially unplanned move to remote working, the team has created a My Ability YouTube channel, which you can see here, to allow for sharing of resources that support the delivery of the packs, including videos on topics such as self-regulation and relaxation tips, which can be useful to support clients when we're having sensitive conversations that occur throughout the programme of sessions. The use of this platform, which can be accessed by anyone, also allows for the use of these supports to extend easily outside of sessions, which has been reported by two of our team's clients who have been working through the pack during their direct therapy sessions together. So a young person supported by a member of the team has been working on their self-regulation skills during sessions and has reported a use of the videos at home on their phone with their support worker and fed back that they really liked the fact that they could just access the videos easily whenever they wanted to, and that this could be done quickly and act as a reminder of which strategies might be useful at that time. The channel and resources can be found easily by searching within the YouTube app or website for My Ability videos. From here, you can really quickly and easily subscribe to the channel for quick access to all new content uploaded to the page, and also for ease of access during sessions with clients or with parents. So moving forwards, we hope to develop the packs further, along with supporting resources and content for our YouTube channel, as well as further trialling the packs and the individual resources within them with AT therapy and Ricolo clinicians. At present, the packs are still at a development stage, so are not available to professionals outside of AT therapy and Ricolo. However, once further design and trials have taken place, we will hopefully be able to give you more information on the use of the packs in 2022. So I'm now going to hand back over to Emily for a discussion where the team will do our best to answer any questions you might have on the packs. And we welcome any comments or feedback that you might have on our ideas so far. Thanks, Emily.
Brilliant, thank you, Nikki, and thank you, Emma and Andrea, as well for your insight and information there that you've shared with everybody. I welcome discussion now, so if anybody had any questions, we've not had any through that I can see in the chat, so if anybody did have anything, having heard everything that Emma, Nikki and Andrea have informed us all about, please do pop that in there now. Somebody did mention at the beginning if we will get a copy of the slides. As I said earlier, the presentation has been recorded today, so it will be available on the AT Therapy YouTube channel for everybody to access. Have we got any questions about the packs themselves or any of the resources and client discussions? Brilliant. So Beverly is asking, can you please describe, ladies, some of the activities that young people have found most helpful?
So a client that I actually work with really enjoyed the role models session, where we talk a little bit about other people that might be more widely known within the community and that may have the same diagnoses. So they found that really, really useful. And it's just, again, started a conversation that we really needed to have, that was quite a sensitive conversation to have and made it slightly more accessible.
Brilliant. Thank you, Nikki. I'm going to go back. There's some brilliant questions coming through now. Emma, did you want to add something there?
Yeah, I was just going to add, within the TBI pack as well, there is a section regarding supporting a client to understand the different lobes of the brain, what those functions are for, and then be able to recognise kind of some of the areas that they then struggle with subsequently following an index injury. And for me, working with my clients, so my clients are predominantly teenagers with a traumatic brain injury and social-emotional mental health difficulties. It was very much like a eureka moment for them. They were like, okay, now I understand why when people say I've got a frontal lobe and these things are hard, that all makes sense because the frontal lobe does this. This is where I was injured during my road traffic accident. And these are the things that I now struggle with. And that all makes sense. And it's been incredibly reassuring for them to actually even just understand that on that level, before you then start working towards acceptance and self-identity. So even at that kind of foundational emergent level, that has been super, super useful.
Brilliant. Thank you, Emma. And thank you, Bev, for that question. We've got the next one, ladies, from Louise, and she says, are we able to contact you about personal issues with students to help with the pack and resources?
I think we as a team would welcome contact. At the moment, as we said, we are only trialling the packs with clients that are seen by therapists from AT Therapy and Ricolo. So if your student or client does have support from one of those therapists, we can absolutely provide some more in-depth feedback and support. Obviously, if your young person doesn't receive support from one of our members of the team at present, unfortunately, we won't be able to provide any more information on the packs at present, but I'm sure as we move forward with further trials and development, that may be something that we can offer to support with.
And also depending on, you know, the client and area in which you work, we've also recently set up a new Northwest brain injury SEN. So if your clients are within the brain injury area, I know that may also fall under autism or CP or other diagnoses, and that Clinical Excellence Network would be another way in which you could kind of receive any additional support.
Brilliant, thanks Emma. And are we able to provide the contact details for the SEN? I can pop that in the chat later.
Yes, it's me.
Amazing. Okay, I'll include that in the chat for anybody that is interested, and I think that's a really great way to get that sort of indirect support as well with the My Ability packs. Brilliant. So Cara has said, these resources sound fantastic. Do you see that they may extend to other needs beyond ASD, TBI, etc.?
Yes, definitely. There's been some discussions about that already. Fran, who's also here today and was a very core member of kind of creating these packs, has also had discussions with other members of the team, speech language therapists, and looked at perhaps in the future creating packs, you know, for hearing impairment. So it's absolutely, you know, an option. I think right now, Andrea, Nikki, Fran, and I are focusing on ensuring that the research that we're doing within these three areas of these three packs are going to show that the intervention is successful, it has positive therapeutic outcomes, and then following, you know, validation that that structure is supportive clinically, we will then launch these packs, and then future discussions, research, exploration into applying that to different diagnoses will also then be completed.
Brilliant.
Absolutely. So we've just finished our feasibility study, but now we'll be looking at trialing it and looking at clear outcomes, quantitative and qualitative outcomes. So absolutely, that's our next stage.
Brilliant. Okay, sounds like there's lots of scope for lots more work as well. We have another question. Are there any packs being developed for life story work or emotional trauma and identity, which I suppose is kind of inadvertently they're being addressed, that I think there would be scope for more areas, but at the moment these are the three packs that are being focused on. That, would you agree, ladies? Yep.
Yep.
Brilliant. I've got a question here as well from a lady who works with pupils with SLD or complex needs and looked after students. And obviously at the beginning, ladies, you mentioned that 3 keyword level is required. Are any of the resources adapted with symbols, etc.?
Yes, so for example, the autism pack has a range of sort of visual supports that can be used alongside it, as has the cerebral palsy pack. But I think we felt quite strongly, and Fran, you might want to join in for this part of the discussion. We felt quite strongly that there are some sensitive topics that are discussed whilst working through this programme. And we felt that students did need to have a certain level of language ability to be able to tackle those subjects in a way that was functional to them and you know, a way that they could understand fully. So I think, again, it's something that maybe we can look at in the future, further adaptations of the packs, but for now we do recommend, you know, 3 keyword level understanding or above.
And as
oh, sorry, go on, Emma.
Oh, sorry, Fran. No, you go first.
I was just going to mention we're very much in the packs talking about things that are outside of the here and now. So maybe the accident that happened before the session, you know, before we're actually talking in the session, or we're talking about goals in the future. So it does involve quite abstract language, talking about emotional vocabulary. So yeah, we felt 3 keyword level understanding to access it was necessary. As Nikki said, we are developing both paper-based and electronic symbol resources to support people to participate and engage. So one of the outcomes from sort of trialing it with people with cerebral palsy, a lot of those clients used alternative and augmentative communication, and we found that within their vocabulary systems, the disability related vocabulary and emotion vocabulary was sometimes limited. So as Andrea mentioned, we've had input from our AT mentor team to develop bespoke resources, symbol-based resources to facilitate discussions as we go through the pack.
Brilliant. Thank you, Fran.
I was just going to add as well, sorry, Fran, for interrupting you. I couldn't see you on screen. That although there are symbols kind of within the packs, and things have been symbolized and language levels are appropriate, should anybody feel that additional support would be required, you know, please do add in. These packs are flexible and there is a structure, but you will know your clients best. You'll know those language levels best. So if you need to amend, adjust, add, remove anything, then that is, you know, a possibility to go ahead with as well. For instance, the TBI pack that I've created doesn't have many symbolized kind of information due to the levels of the language levels within that client group for our company. However, that may be very different in a residential unit or elsewhere. So there is flexibility within that.
Absolutely. And we welcome feedback as well. So, you know, if anybody does create their own resource to go alongside it, let us know. That would be fantastic. You know, we are still in a development stage and are absolutely open to amending and adding to these packs as we progress.
Real. Thank you so much, ladies. Okay, I've just shared the information there about the SEN for anybody, and I'm going to go back to where we were on questions because they are coming through thick and fast now. So we have another question about when this is likely to be available and if we know of a young person who may benefit. Are you looking, ladies, for people to take part in future packs moving forward to give you more data, or have you kind of got everything that you need?
No,
we did mention 2022, sorry.
Yeah, sorry. Yeah, referrals to Ricolo and AT therapy. Our clinicians will be able to utilise the MyAbility packs as we're shaping them and developing them. And so, yeah, referrals to us for the time being.
Brilliant, thank you. And we've got a question from Natalie here around how individuals with the diagnoses that we've discussed today, so how have autistic individuals with TBI or cerebral palsy been involved in the development of the packs, which I know has been kind of touched on, but yeah, would there be any elaboration there?
It was right from the start, really. When Andrea and I started to talk about it, the very first draft was a CP pack, which we sent to a young lady with cerebral palsy and her parent or carer. And it was really useful to have their input at that stage because we changed quite a lot of the terminology. So it's been right the way through. And as I said now, with the CP pack, with Jamie, who's one of our AT mentors, developing the symbol-based resources, we really want it to be something where the individuals are at the centre of what we're doing. So we're gathering regular feedback. As Andrea mentioned with the feasibility study, the Survey Monkey was accessible to the young people who were taking part in the pack so that they could provide their feedback on what was most useful, what was least useful, what they liked, what they didn't like, what they would like to change, etc. So,
well,
I think even indirectly as well, you know, the experiences that we've had delivering, especially during COVID, where we've had to make so many changes, so many adaptations, you know, our service users haven't necessarily voiced their opinions on access. However, we've interpreted some of them and, you know, we've realised actually this session didn't work too well in an online format. So as a result of our users' experience, let's adapt it and make it, you know, more flexible and more accessible in that format.
Real. Julie has asked, would it be possible to see one or two resources? I appreciate that that's probably not possible right now, but in terms of the MyAbility YouTube page, are things signposted clearly on there?
Absolutely. So YouTube wise, if you just search for our page, all of our videos are available on there. We've got a brief introduction video, some videos on techniques that we refer to within the packs. And as I said before, some sort of top tip videos as well. So they're all freely accessible right now. Feel free to subscribe. And as we said, you'll then be up to date with all the new content as it's uploaded.
Brilliant. Thank you, Nikki. We have another question from Nicolette around if a child has limited ability to reflect about past and future, and we've kind of talked about that abstract language level already, how is that supported? Are there any adaptations to the resources?
I don't know if you want to talk about that, Nikki, because your pack, Autism pack.
Yeah, so in my autism pack, we have adapted a lot of the resources to include symbols, just to make some of those abstract concepts a little bit more concrete. I think some pre-teaching of vocabulary may also be really useful with these packs. And again, it's something we're sort of taking on a client by client basis at the moment during this stage of trial. So it may be that some of the terminologies that our young people haven't come across before, we actually need to access before the pack. So with a client that I've been supporting, they didn't really understand a lot of the terminology around brain injury. So what we really needed to do was actually do some pre-teaching before we started the session on learning about terms related to brain injury, just so that he was aware and understood the very basics before we targeted some of the more complex vocabulary within it. So yeah, again, I think we're learning as much as anybody else right now and really adapting things as we go.
And I think, like Nikki's just said, it's about working on that individual basis and empowering you as the clinician. You will know that client best. You'll know their levels of what they cannot process, can or cannot retain. And for you to use the structure from My Ability when it has launched, which will hopefully be in the early new year, to inform, what you're working on. So if a child does have limited ability to reflect about past and future, then that's okay. Is their main target about developing their self-esteem in the here and now and in the present? Because if that's the target, then that can still be done. So it's just about kind of identifying, I think, really what is needed for that client at that moment in time, and how can that be successfully implemented, taking into account everything you know about that client's presentation, plus the resources, which essentially will structure and cut down on your planning time massively, but we can't promise that there'll be no additional planning for you all if you need to amend some of those resources.
I think it's about using it flexibly as well. Like within the parent and carer pack, there's a visual timeline where you talk about diagnosis and feelings as you go through that timeline. So I'm just thinking with this young person, obviously I don't know them, but that resource would be downloadable, as Emma said, that could be used then within that session with the young person as well, with Nikki's added visual symbol support as well. So yeah, we encourage clinicians to use it flexibly, and obviously anybody else can be guided by a therapist to support them to implement it.
Brilliant. We've had comments really around the flexibility sounding like it's nice and holistic for whoever's using it. So I think, yeah, that's a really apt way to describe it. We've had another question around clients who were slightly younger, but still asking same sort of questions around identity and the self. Do you think that any of the packs will be adapted for a younger audience, or kind of is there that flexibility within some of the packs as they stand?
I think there is a flexibility there. And, the aim of these packs is to provide an evidence-based intervention that can be used flexibly by a clinician. We often struggle to find the time to go away and research our evidence bases in the in-depth way we would possibly like to. So what this enables a clinician to do is to actually have all of that taken care of, and to have a set of resources that have been created in line with that evidence base, to be able to then move forward with as they see fit, in line with their sort of clinical judgment and knowledge of the client. So it could absolutely be adapted. I think it's just a case of using your own clinical judgment.
And I think that's a really good topic for us for future, when we're looking into future applications following the launch. But ultimately, if you're working with somebody who's 7 and has 3 keyword level and they are asking those questions, then it is absolutely appropriate. So even though we kind of say 10, if they're interested, seeking, need to be seen and heard, and go through that, and they have an appropriate level of understanding, or you're able to facilitate it at a lower level, then that can be used immediately and wouldn't necessarily need to wait for kind of our future applications or evidence base, because that will come in future. But yeah, again, it's going back to that flexibility of the use of the packs and empowering the clinicians as much as the clients, essentially, to be able to go ahead and feel comfortable in doing this, because when we were talking at the recent SEN, a lot of the clinicians kind of shared that these topics do come up, and although they do refer to psychology, sometimes that's actually due to their own repertoire of skills, because they don't want to say anything that may not be appropriate. And one of the ladies kind of shared that she didn't want to make it worse, by trying to have those conversations, but not having confidence or skills within that area. So although these packs are for our clients to develop that self-worth, that identity, it's also to empower the clinician, whether that is a psychologist, speech language therapist, and as Andrea has rightly said, this is a full MDT approach, to use that structure to be able to do that and feel confident and secure with doing it.
Well,
I think as a team, we're really reflecting continually. Andrea and I had a meeting this morning with the Child Brain Injury Trust, and they were saying, when do we do these packs? And some people felt, for some of their clients, it'd be really appropriate in the hospital setting straight away, whereas for other people, they may need a while to come to terms with like Andrea said, who I am now, to acknowledge some of those strengths and difficulties, and then that may be a different time. So again, it's really using them flexibly, but we are, as we're getting this feedback, I think as a team it will really help us to evolve it as well.
Real. And you've all kind of touched on that multidisciplinary approach there, but we've had another question from Jessica, and I think we've got some other educational professionals in today that are just asking around the role of the educational professional, the teachers and the school staff, in supporting children to access these packs. Has that been explored, and kind of what do you guys think about the role of the educational team?
I think our view would be that we would want anyone working with these packs to be guided and supervised by a therapist, because all sorts of very strong emotions can be brought out by discussing these feelings, these events that have happened to this young person. So it does need to be well managed. So we would say that certainly members of the MDT who are therapists and people who are qualified therapists, but otherwise they would need to be supervised. Thank
you, Andrea. The next question, and we are getting there now. Thank you so much, everybody, for these brilliant questions. It's absolutely fab. Is, can you tell us a little more about the pack that you're developing for parents and carers, the one that goes alongside? What sort of activities are in those packs?
So I think the parent pack is to be used sort of alongside the pack for the young people. So again, it's to be used as and when is appropriate. So it's to support the parent also in, understanding and coming to terms with the changes that have happened to their child or young person, and to think about moving forward. So something about the parent pack that I really like is just the sort of ability to highlight places to go for support, and to talk to other people who are in the same position as you, which is something that I think we often take for granted as professionals. We have a range of people around us who understand the world that we work in, and the terms that we use, the conversations we have, whereas for some of our parents, they might not have that. So by highlighting other places they can go to for support, I think it's really useful to enable them to engage in conversations with somebody maybe outside of their MDT, that they can have a conversation with parent to parent, or partner to partner.
And also as well, there's resources for structured conversations regarding identity with the parents too, so there's the opportunity to reflect on their experiencing of caring for their young person, including both the highs and the lows. Opportunity to explore events that have shaped those experiences, and recognition of, some things are going to be in that parent's control and some things aren't going to be. So again, it's just some structured resources to facilitate those difficult discussions, and nurture and support our parents as much as nurturing and supporting our individual clients, because there is a lot of trauma that's involved with the diagnosis, and particularly if it's been a traumatic diagnosis such as a brain injury, and that trauma remains in the family, it remains in our bodies, and it's an essential part of supporting this process is supporting the people around that young person, or else that trauma and difficulty with self-esteem and identity will remain in the family unit as well.
Absolutely. Thank you, Emma. A couple of people have asked for the websites for AT Therapy and Ricola, so I've popped those in the chat now. We have a really great question from Simone. Just let me scroll back up there. So Simone has said that these sound like really fantastic resources, great work, but we all, Emma, Andrea and Nikki, work in teams where speech therapists liaise with a psychologist. Could working as a speech therapist without this backup from psychology raise issues for the speech therapist about how to handle those emotions and how to proceed with the facts from that psychological perspective?
Could working without this backup raise issues for SLTs in terms of, just for Simone, is that with regards to clinically, another person questioning the speech language therapist, or the SALT within the session? Managing the client's emotions.
Yeah.
Sorry.
I think they probably mean in the session.
Right.
And I guess that was our whole aim, was to develop a pack that members of the MDT could carry out on their own, that they're designed for a therapist to work using these materials on identity. And yes, a lot of the time we do have psychologists on the MDT, and that's brilliant. And, you can refer to them and have discussions with them. And I'm sure they'd be interested to see the content of the packs. But these packs are designed for you as speech and language therapist to work through on your own.
Well, thank you. We've got some other really great comments here as well coming through around that it's great that the team here have identified really that speech therapists as a profession have a vital role in this process of identity and self-identity, particularly if children are at earlier levels of understanding, speech therapists in terms of adapting language levels and identifying core areas to work on. So thank you for that comment. One further question here is from Michael, which is around the range of disabilities within the 3 packs that have been created so far are extremely wide. How are the packs tailored to the individual child and the specific nature of their presenting difficulties?
So you're absolutely right. There are a range of disabilities within the diagnosis, but those are more symptoms within that diagnosis, unless there's a comorbidity, which you will know for your individual clients. So that will be you as a clinician to then identify, okay, this section will be appropriate for this section will be appropriate for that. So the packs are tailored to having a structured discussion regarding identity and kind of those overarching themes of accepting the core diagnosis. If that child or client specific to you wants to know further symptoms within that, so within traumatic brain injury they want to really know about impulse control, or they may really want to know about sexual disinhibition, whereas with autism they may want to know more about sensory stimulation, or they may want to know more about inflexible thought processes, then hopefully that empowers you as a clinician to follow that client's lead and support using the structure to have those conversations. But you're absolutely right. The sheer amount of symptomology, presentation, functional engagement outside in the community is so varied. We can't possibly identify every, event, circumstance, feeling that person may have. So what we've tried to do is develop a general structure that will guide you in being able to have those one-off conversations when they do come up. Does that cover everything? That was questions. And then what forms of information are already available upon which the individual intervention programs are based? Would Nikki, Andrea, Fran, have you got anything further to add, do you think?
I
think I would probably just add that the information that we've based our individual packs on obviously is more generalized based on, you know, the overarching presentation. So for example, for the pack that I worked on, autism, so within that we have taken information from a sort of higher level, if you like, so thinking about the more general terminology, the more general topics that we may want to cover, but as a treating clinician, you would again use your judgment and use your own clinical knowledge and experience of actually what is appropriate and what isn't appropriate. So, for example, 2 clients that I'm currently supporting, we're working through the TBI pack with, the delivery of the pack is completely different with each client because their need is completely different. So some information has been covered with both, some information hasn't, because it just wouldn't be appropriate. And it's that level of flexibility we really want to get across to you, that this isn't a pack that needs to be followed, you know, to the line, to the letter, exactly the same delivery every time, like you would a standardized assessment, for example. This is meant to be a tool to guide your clinical working and your clinical decision making. And I think it really is just a basis really for structuring your sessions of intervention with your individuals.
Just to add to that as well, very briefly, that there isn't much online. If you try and search in this field for resources to support people to understand their disability, it's extremely limited. So when I started the journey with sort of CP, I contacted charities like Scope, and they were able to provide me books with disabled characters, which were aimed at very young children. There was nothing available for teenagers. Or, you know, it wasn't, if it was a website with no symbol support, with extremely complex sort of medical terminology as well. So I think this is where my ability was born really from. It's not based on information that's already available. It's very much an innovative resource that we've developed jointly between AT Therapy and Ricolo.
And because there is a lack of, you know, research, and it is born out of the fact that we've identified there isn't much research in this area, that's why we're then doing the feasibility study and ongoing research, both quantitative and qualitative, to provide that evidence base.
Brilliant, thanks guys. And I think more information will be kind of available, won't it, as the packs continue to be developed and you get towards that 2022 time frame. We do have still a couple of questions, but I'm conscious that Adam has a question and has been waiting to ask his. So are you free, Adam?
What about social anxiety and other mental health problems?
Brilliant. Did everybody hear that okay? Fab.
So social anxiety, a client that I'm currently supporting really did not want to do one of the sessions based on reaching out to others purely for that fact. So for them, we just decided actually now wasn't the right time. She's not quite there on her journey, and that's fine. It's something we can look to work towards in the future. And that's probably something that as a speech and language therapist, I will be seeking more advice and more multidisciplinary working on to make sure that we're meeting, you know, those social anxiety needs in a different way, maybe with the team as a whole, rather than during our individual sessions. I don't know what everyone else's thoughts are.
Absolutely. And it's about, you know, a bit like what Fran was saying before, it's about identifying about what is the right time, because, you know, positive self-identity, self-esteem is absolutely essential and integral to mental health. But then on the flip side, recognizing where somebody is within their mental health, they may not be ready for this right now. It may be too big for them, and it might be a future goal, or it might be something that can be used as a catalyst to improve their mental health. So again, it's about the client being involved in that decision-making process too. Is now the right time? Are they asking those questions? Are they seeking that? And if they do have the ability to have those conversations with you, then please go ahead and do involve them within that to identify if, yeah, this would be great to do now. My social anxiety is a bit too much, so let's do that another time, perhaps work to that. So absolutely, I think it's really important to consider all of those different factors and take that into account when preparing or planning and seeing what the client wants to do themselves.
Absolutely, Emma and Adam, that's absolutely right. What we would do is we would plan as an MDT and all working together to think about whether we do the My Ability work after we've thought about the social anxiety, and we'd work together as a team, speech and language therapists, OT, psychologists, all work together on a shared goal of how we can overcome this social anxiety first and foremost.
Brilliant. Thank you, ladies. And thank you, Adam, for that question. I'm just conscious of time. So Michael has responded, thank you, ladies, and said, thank you for your responses. There are many hidden disabilities for children with all of these conditions. And his question was around what information is available with that hidden disability in mind. But I think you've said already, haven't you, welcome questions and feedback. So I think potentially a direct email would be great to continue that discussion.
Yeah, and also as clinicians too, you'll absolutely know your client and you'll know what they'll mask. And so for me, within traumatic brain injury, they just mask, because they're quite high level. There is a lot of masking. So my other work with those clients is kind of doing through assessments to identify or taking into account frontal lobe paradox, different things. So I think you will always be the best person for your client because you'll know those hidden symptomology within that, definitely.
Brilliant. Thank you, Emma. I'm just conscious of time, and we do perfectly just have one question left, so let's get that one, and then we have hopefully managed to answer everybody's queries. Claire has said, could any bits of the pack be done in groups?
I think they could, but I think it's also important to recognize that there may be some very difficult emotions that come up, so it's about knowing the group. So if you're in a school, I don't know what setting you're in, sorry, but say if you are, you might know that there's two really close best friends who really want to be happy to work on that together. You might have a group of kids where you just think, oh my goodness, no, if they're all emotionally dysregulated, then that is not going to be good for them or for you as a clinician leading that group. So in theory, yes, but in practice, I'd really consider whether you think it would be appropriate for what may come up for that individual client, and then how those individual clients' responses would work together as a group.
Thank you, Emma. Does anybody else have anything to add there?
I think what Emma said about masking earlier is something to really bear in mind when you're thinking about working in a group. Is your client ready to be open in front of a group? And I don't think I would be if I was put in a group situation and asked to discuss really sensitive topics. So there may be clients that are, but there may be clients that aren't. So really have a think about that and a discussion maybe as a wider MDT.
Great. Thank you, and thank you everybody for your questions. There's been a really great discussion going there. We've actually been talking and discussing for nearly half an hour, so that's really great to have so much feedback and response from people. Thank you for engaging. If everybody is happy, we have timed it pretty perfectly, and we are ready to wrap up. So as you can see on screen there, the next lunchtime webinar hosted by AT Therapy will be around increasing parental engagement in AAC, using something called the Less is More framework that's been developed by the AT team. So that'll be myself hosting that, and the date is on screen there. Thank you for the lovely comments there, guys. They're still coming through thick and fast, so we'll keep a note of those. Thank you. Upcoming events as well that are really worth noting. We have the literacy webinar series, which are delivered by Andrea, as you can see on screen there, from AT Therapy, and Tina Voisey, previously of Boardmaker. So the dates for those are on screen as well. We've had a really great response from those, but if anybody else is still interested in that literacy webinar series, they are available. We've also got the Play Included training there, which will be hosted by Nikki. That'll be coming in autumn of this year. We'll get dates to you as we sort of progress with these webinar series, but there's some exciting and really interesting courses coming up there, so you can book and follow anything coming through on Eventbrite. Brilliant. It's also just worth mentioning before we finish that AT are recruiting So if you are a speech and language therapist with experience in any of the areas that's been discussed today, or you've liked what you've seen so far from our team, please do drop your CV into andrea@atherapy.co.uk or hayley@atherapy.co.uk. We are excited to hear from you. Further resources and freebies and things that you can get from our team are the training videos on our YouTube channel. So if you want to subscribe there, Nikki, Emma and Andrea have also shared with everybody the My Ability YouTube channel. You can also follow any of the AT Therapy Instagram accounts. We often post little freebies on there, posters, tips, strategies, things that you can print off and take away. So those addresses are all on there. And if you do want to keep up with the AT team in general, there is the AT Therapy Facebook account that you can also go to. And I have also shared Rocolo's website, again, in the bottom of the chat box there, so everybody can go and have a look at everything that's going on at Rocolo, find out a little bit more about Rocolo and what they can do too. Thank you so much for joining, everybody. Really grateful for everybody's time. Thank you. Absolutely. Still lovely comments, which is lovely. So thank you for attending. We have really enjoyed the discussion today and we hope to see you at our next webinar. Thank you so much, Emma, Nikki and Andrea.
Thank you for everybody attending as well.
It's been great
Thank
to
you.
see all the lovely comments.
Fabulous.
Thanks and take care.
Thanks, Adam.
Thank you, Adam.